Hey, everybody, welcome back to another episode of Confessions of a Male Gynecologist. I'm your host, Dr. Shawn Tassone, America's Holistic Gynecologist. Private practice based in Austin, Texas, and I'm licensed in over 40 states in this amazing country we have. So if you're struggling with your hormone replacement, if you're not getting the answers you want, doctors won't test you, you know the drill. You can call my office, 512-956-0296, to see if I'm licensed in your state. You can also go to Instagram, Shawn Tassone MD, and you can find my second pinned post. I do have the states listed where I'm currently licensed. And if I'm not licensed in your state, well, you just hang in there because I will be soon. You can also buy my book, The Hormone Balance Bible, on Amazon for about $16. 500 pages of everything you ever wanted to know about hormone replacement, put in a language that's easy for everybody to understand. I talk about labs, I talk about all the hormones, the different types of hormones, ways to take them, and what the symptoms are. So I would start there. Now, speaking of hormones, as I like to do, they are somewhat controversial. They shouldn't be, but they are. And the reason that they're controversial is because of that damn study that came out in 2002 called the Women's Health Initiative. Now, I wanted to just kind of talk about this controversy because it comes up all the time. If you personally aren't scared of hormones, what generally happens is I'll get a woman who wants to be on hormone replacement, and then somebody in her family or a friend will say, oh my God, I can't believe you're taking that. That causes cancer, blah, blah, blah. Even though they don't have a medical degree, they're not writing prescriptions, and they have absolutely no idea what the hell they're talking about. So I wanted to just kind of run down the controversy, the history, and what's going on from the past to the present. So the history of hormone replacement therapy started in the 1960s. And then kind of reached popularity in the 90s when I was in residency. I can remember I did my residency at the University of Oklahoma from 94 to 98. Yes, I'm that old. And back then, everybody got Premarin. I mean, 99% of the prescriptions we wrote were either Premarin or Prempro. There was this weird medication also available called Estradiol. That was a bioidentical estrogen, Estradiol, but we didn't ever prescribe it. One, insurance companies wouldn't pay for it. Two, we really didn't know what the hell it was. And so we just prescribed Premarin. Yes, we were spoon-fed from Wyeth Ayers, who was the company that made it. They bought lunches. They educated us. Yeah, so we prescribed a ton of that. The first clinical trials on hormone replacement and postmenopausal conditions were started in the United States in the late 1990s. After the announcement of the first results of the Women's Health Initiative, which was in 2002, unfortunately showing that HRT had more detrimental than beneficial effects, basically hormone replacement at that time just plummeted. I was in private practice in Tucson, Arizona at the time, and I can remember half of my patients calling in, just freaking out, stopping their medications. Most of the others didn't bother to call. They just stopped, and then everybody felt miserable. The negative results of the study received wide publicity. I mean, it was all over the news, created panic in most users, as I just stated. And basically, doctors were left kind of in a lurch. The American College of OBGYNs didn't tell us what to do. They didn't know what to do. We got absolutely nothing from them. And so, as doctors do, we make do with what we know. We make do with what we do. And so we had to kind of come up with things on our own. And in the following years, a reanalysis emerged from the Women's Health Initiative trial. And then new studies showed that the use of HRT in younger women or in early postmenopausal women actually had a beneficial effect on cardiovascular systems, reducing coronary artery disease, and basically all causes of mortality were decreased in these younger women. Notwithstanding this, the controversy continued, and in my opinion, really hasn't changed much in the last 20 to 23 years. We still have a lot of fear around HRT. We have doctors that still won't prescribe it. We have doctors that obviously haven't read a study in 20 years, because I can't tell you how many times I get barraged with this from patients who are told their doctor won't prescribe for them hormone replacement. In the 20th century, the interest around menopause has been increasing, and you see it now everywhere. And a lot of that, for better or worse, is from celebrities who are hitting their 50s. And I've talked about this in other episodes. Unfortunately, they're going the way of making money from the movement instead of trying to just raise awareness. And what they're doing is they're raising awareness because they want to make money from it. So what is this thing that has been kind of coined hormone deficiency syndrome? I mean, it's all the symptoms, and it's all the symptoms that you really hear about or don't hear about. The two things that the North American Menopause, or the Menopause Society, now basically has reduced women to are hot flashes and vaginal dryness. While these are super important, they're not the only symptoms of menopause. You have cardiovascular events, you have Alzheimer's disease, you have fatigue, insomnia, irritability, anxiety, depression, skin changes, hair thinning. The list goes on and on and on. Now, the feminist movement in the 1960s changed women's health and life expectancy by encouraging menopausal therapy. This happened actually initially in European countries. There was a couple of books that came out back then. Women were becoming more empowered back then in the 60s and 70s, and we started moving in this direction. But the main estrogen that was available was what we call conjugated equine estrogen, CEE, or Premarin. Premarin being a shortened way of saying pregnant mare urine. What they would do is they would basically put these poor horses who were pregnant into stalls and then just collect the urine. And the reason everybody asks, well, why did they do that? What's the purpose of that? When you can make an estrogen from soy, or you can make an estrogen from yam, why would they do this? And I'll tell you why. In order for a drug to be patented, in order to patent a drug for 10 years so you can make a shit ton of money off of it, you have to have something unique. So it either has to be the delivery system, or it has to be a chemical that you've kind of come up with. They couldn't patent estradiol. Estradiol is a naturally occurring compound. Progesterone, testosterone, you can't patent these drugs because they're natural. So they have to change a couple of bonds. They have to move things around. And the way they did that was with pregnant horse urine. And that's another story altogether on medications and patents and why things cost so much. But basically, if you look at the first randomized clinical control study that was done to prevent cardiovascular disease, called the HERS study, Heart and Estrogen Progesterone Replacement Study. Basically, there were 2,736 postmenopausal women with established coronary heart disease, and they were randomized to receive hormone replacement therapy, which at the time was 0.625 milligrams of Premarin and 2.5 milligrams of medroxyprogesterone. So they basically got Prempro. And in my opinion, Prempro was probably one of the worst medications ever invented. Basically, what they looked at was they compared that group with a placebo group who received a pill, but basically had sugar in it. And there was no difference found between the two groups after 4 years. But in the hormone replacement group, the Prempro group, there was an increase of coronary events after the first year. And then that obviously freaked everyone out. In 1998, the Women's Health Initiative was started, kind of came out, finished up around 2002. At the time, it was the largest randomized study that was aimed at evaluating the effects of HRT on the most common causes of death and disability in postmenopausal women, like cardiovascular diseases, cancers, and osteoporosis. Women with a uterus, there were 16,608 participants, were randomized and received, again, Prempro or Premarin. And women without a uterus, which were 10,739 women, were randomized and received either just Premarin or a placebo. So the group with a uterus was given Prempro because they had to have progesterone in there, or progestin. And then there was a group without a uterus that just got the Premarin, or the conjugated equine estrogen. And those two groups were also placeboed out. So there was a group that took the pill and a group that took the placebo. The first results of the Women's Health Initiative were published in 2002, which was about 5 to 5.5 years into the study. And in the group with a uterus, so the group that was taking Prempro, there was an increased incidence of coronary heart disease and breast cancer. But there was a reduction in osteoporotic fractures, and they didn't talk too much about this, but there was about a 50% decrease in colon cancer rates in that group. Given the results, what they did was they said, well, crap, the risks outweighed the benefits, and the trial was discontinued. The results were then disseminated to the media, who took it and went with it. Now, what's interesting, and they don't talk about this very often, remember I told you there were two groups. There was the Prempro group, and then there was a group without a uterus that only had Premarin. That trial of women that only took estrogen, that didn't have a uterus, that only used the Premarin continued for another couple of years. And so, because there wasn't that increased risk. And so what happened was the Premarin only arm, the conjugated equine estrogen only arm, didn't have those same risks. So there was something about the combination of the estrogen with the progesterone, or shall I say the synthetic estradiol, or CEE, with medroxyprogesterone. The question is, do you run away from a medication that can help millions and millions of women if there's an increased risk? Okay, that's one question. The second question would be, can you transpose this data over to bioidentical hormones, which are completely different? It'd be like comparing, to me, ibuprofen to Tylenol. They both kind of do similar things, but they're not the same drug. One is processed through the liver, the other is processed through the kidneys. You know what I'm saying? We just automatically transposed that data over to all forms of HRT. So the follow-up with the Women's Health Initiative continued for about 13 years, and some results, including an age-stratified risk of cardiovascular outcomes, was published later. And new studies and meta-analyses showed that the use of HRT in younger women, 50 to 59, or in early postmenopausal women within 10 years of the menopausal onset, probably in the same group, had a beneficial effect on the cardiovascular system, reducing coronary artery disease and all causes of mortality. They weren't dying. Furthermore, a larger controlled trial from Denmark that was reported in 2012 demonstrated that healthy women taking combined HRT for 10 years immediately after menopause had a reduced risk of heart disease and death from heart disease. Unfortunately, that data didn't really get much coverage because of the fear that was created from the Women's Health Initiative. So let me just report this again. In 2012, there was a study done on women around the ages of 50 to 60 who started HRT immediately after menopause that showed a decreased risk in death and heart disease when they took hormones. You don't really hear much about that, do you? So basically, what you're seeing is a sensationalized story from the media, and that in and of itself has caused 20 years, almost now 25 years, of fear of HRT that still lingers today. I mean, I can't tell you, if I see 10 new patients, probably 8 of them will either have a story where a doctor was afraid to give them hormones, a doctor was gaslighting them because they didn't want to do hormones, or the patient ended up getting hormones and then somebody in her family told her she shouldn't take them. I also can't tell you how many women will say something on my Instagram page where I will put a post up that says estradiol has not been shown to be a cause of breast cancer. And I'll inevitably get 2 or 3 women that will say, wow, my mom was fine. She started HRT, and a year later, she got diagnosed with breast cancer. So screw you, Tassone. My response is this. To have a palpable breast cancer on an exam, we know that based on cell reproduction, that it takes about 3 years for you to be able to feel that. So that cancer was probably there 2 years prior to her starting the HRT. And I will challenge anyone to find a study that shows unequivocally that estradiol causes cancer directly, because you cannot. And if you did think that, then you would have to then follow this same logic. If estrogen caused cancer, why wouldn't we see breast cancer spikes in women in their 20s when your estrogen levels are the highest? Why would we be seeing it in women that are older, in their 70s, 60s, and 70s? And the reason is it's more of an age-related disease, not a hormone-related disease. Now, that being said, if you have a breast cancer cell in your body that has an estrogen receptor, and I give you estrogen, it could stimulate the growth of that cell, but that's not cause. That's propagation. That's stimulation. That's not cause. So don't come onto my Instagram page and tell me that your mom's breast cancer was caused from estrogen. It wasn't. Now, if we knew that, then we would be stopping every woman from ever having estrogen in her life, or a man for that matter, because then everybody with estrogen is going to have breast cancer. And that's just not how it works. But anyways, this is how the narrative has changed everything. So let's look at breast cancer and the effects of hormone replacement therapy. Over the years, the data regarding the impact of hormone replacement therapy on breast cancer has been I'm sure we would all agree, controversial at best. Basically, the meta-analyses and the observational studies in the 90s reported no increased risk in breast cancer with estrogen use. Estrogen, not estrogen and progesterone, straight estrogen. Never been a study. There were some increased risks, however, related to the dose and the duration. So that's different. But that was with combination. So that was with the CEE with medroxyprogesterone. The Women's Health Initiative, that god-awful study, reported increased risk in breast cancer in the women treated with that combination pill. And that was significantly higher than in the placebo after about 5.5 years of treatment. The risk of breast cancer was significantly lower than in the placebo group for users that were treated only with the estrogen. So this is what's fascinating. The estrogen-only arm actually had a decreased risk of breast cancer, but you didn't hear about that. So obviously, estrogen isn't the culprit, right? Estrogen seems to have been protecting women against breast cancer. And if you go back a few months in my podcast, I actually talk about a study that came out last year that showed that women over the age of 65 that were on estradiol had decreased rates of breast, colon, lung cancers, and dementia, and less morbidity, mortality, meaning they lived longer. So take that as you will. What are the consequences then of women who came off of their hormones? Well, following that WHI study in 2002, when I was only 4 years into practice, saw huge amounts of women come off of their hormones. So what did that do to women? So all of a sudden we had all these women coming off of their hormones. You would think if it was estrogen, that the breast cancer rates would go down and all that stuff. And what we found was that after the Women's Health Initiative publication, the use of hormone replacement, this was studied in Northern California, declined by about 70%. So 70% of women basically stopped their HRT in California. At the same time, breast cancer incidences decreased by 10%. So what they thought was that because 70% of women went off of their meds and 10% decline in breast cancer, that they thought that it was because they went off of their hormones, which actually didn't pan out. And actually, you would think if 70% of women went off the HRT and only a 10% decrease in the hormones, that it probably wasn't the hormones that were the cause. It was multifaceted, which is what we know about breast cancer. It's age, it's genetics, what you eat. Did you ever have a pregnancy? Did you breastfeed? Because that can be protective. Were you ever on birth control pills in your life? Because those are a known carcinogen. There's so many facets to breast cancer, even things like where you live and the pollution in the air. So basically, it can really make a difference, but it didn't make a massive difference in the numbers. So what they did in Italy and the Netherlands, and actually I think Spain, there was a decline in therapy after 2002. But in those three countries, they did not notice a decline in breast cancer rates. In the UK, the use of HRT peaked in 2002 and decreased afterwards because of the Women's Health Initiative. And in the UK, breast cancer declined by almost 1% after women stopped their hormones. But it was only like 1%. So basically, we then look at breast cancer in a different light. At least I do. The use for, let's say, uterine cancers, because I do have some women who will reach out and say, well, what about uterine cancer? Which is obviously also a hormonally driven cancer. But we know that unopposed estrogen causes uterine cancer. So if you take estrogen and you have a uterus and you just give it to women with no progesterone, that's called unopposed estrogen. Because you're constantly stimulating the cells of the lining, you can cause an overgrowth of tissue, which in some instances will stimulate this cancer. So basically, what they found was that oral micronized progesterone, because they started using bioidentical progesterone, if you administer the progesterone at least 12 to 14 days a month, in the studies they used 200 milligrams. That treatment had a protective effect on the uterus for up to 5 years. Now, that's the other thing. You have to realize that women who are on unopposed estrogen, the cancer, I have women will call me and they'll say, oh my God, I ran out of my prescription for a couple weeks of my progesterone. Am I going to be okay? Yes. It takes a long time, at least probably a year or so, for you to have unopposed estrogen to cause some sort of uterine cancer or uterine cancer issue. So then we look at cardiovascular diseases with hormone replacement. The study of women's health across the nation, the SWAN study, Women's Health Across the Nation, SWAN, showed that women with hot flashes had higher subclinical coronary vascular disease, including aortic calcifications, poor vessel function, and higher thickness in the blood vessels than women did that didn't have those symptoms. And they also found that clinical studies in this group showed that hormone replacement therapy favorably impacted the risk factors for coronary artery disease. And that was not the case necessarily with the Women's Health Initiative. So we know that the coronary vasculature, the heart, is protected to a certain degree with HRT. So we have to look at all of these things. I don't see personally overwhelming data that shows estrogen or progesterone is bad for your health. And if anything, can help you live longer. But for some reason, this overwhelming thought process from the Women's Health Initiative still lingers today. Now, I'm not digging into the details, the numbers and all that. We could do that, but it's kind of ridiculous to really dig into the actual percentages and and we just look at overalls. Now, obviously, let's say you have a question. Do oral contraceptive birth control pills make you gain weight? And you could say that to a doctor. Is this birth control pill going to make me gain weight? And more than likely, they will say no. And the reason they do is, let's say there's a study done on 10,000 women. There are going to be some women that gain weight. There's going to be some women that lose weight. But what we do is we speak in absolutes. So overall, no, birth control pills don't cause weight gain. We do know that birth control pills can increase the risk of breast cancer over your lifetime. And yet, doctors prescribe birth control pills for freaking everything. From birth control to endometriosis to fibroids to heavy periods to cramping to migraines to I just don't like my period. They'll prescribe birth control pills like freaking crazy. And we know that extended use of birth control can increase the rate of breast cancer. I have women in their 50s who are still on birth control pills because the doctors just keep them on them. And yet they're not going to give a bioidentical, meaning it looks like your body's natural hormone. They're not going to give that doesn't have any data to show that it causes breast cancer. And strength-wise is about 1/7 to 1/8 or so of the strength of a birth control pill. And we give that out like candy. The logic between my brothers and sisters who are prescribing hormones is absurd. There isn't any logic involved here. They're not thinking. They're just doing. They're being automatons, and they haven't bothered to, even gynecologists. I'm not even talking about family practice doctors. Gynecologists and endocrinologists have had their heads so far up their own asses for the last 22 years. They're afraid of prescribing hormones that can be helpful for cardiovascular disease, that can be helpful and possibly protective for breast tissue. And then the last thing I wanted to talk about was osteoporosis and osteopenia. We know that estrogen inhibits a cell in the body called an osteoclast. An osteoclast is a cell that eats old bone, and then an osteoblast comes in and lays down new bone. Well, with decreased estrogen, the osteoclastic activity can increase, thus eating more bone. And if you don't have adequate testosterone levels, which stimulates the other cell, that osteoblast, to make new bone, you got a 1-2 punch for osteoporosis. Clinical studies on HRT have unanimously shown that any kind of hormone replacement is capable of reducing that bone turnover. It reduces the reabsorption of bone, and it increases the mineral density of your bone. Overwhelming. There's not even a question. We know this. And we also know that women who are older, 70s, 80s, they shrink. We talk about it all the time. We joke. I have women come in and say, I don't want to get short like my grandma who shrunk. Why did she shrink? Because her bones got mushy in her vertebrae and they crush down on each other and you get hunched over. We can prevent that. We can prevent that. We don't, because we're too freaking afraid of breast cancer, which has never been shown to be increased with estrogen. Anyways, it's a soapbox issue. But I would challenge you to share this podcast because, if anything, the controversial history of hormone replacement is about the history of women. It's about the history of women being mistreated by the medical system, being underrepresented in literature and research, of being gaslighted in the medical community, even in the overwhelming evidence of the possible benefits of hormone replacement therapy. My theory is this. Hormone replacement therapy is not life or death, except for thyroid and cortisol. You need those to live. Estrogen, testosterone, DHEA, progesterone, they're not necessarily needed to live, but you might be feeling like you don't want to live. And because we don't care about women in this country, because we just kind of minimize women in this country, we think you should just suck it up. And yet, every 20 feet in Austin, there's a testosterone clinic for men. And I have a feeling that things are going to move the other direction, and they already are. You've got companies out there, Winona, MyAlloy, Alara. And what they're doing is they know that there's money to be made because there are millions and millions of women suffering. And they're advertising on Facebook and Instagram, and they don't care about you. It's a volume-based company structure. They have to see thousands of patients to make money. And I've heard this from patients. They order another one is Joy Wellness. They're basically ordering all these fancy labs that you probably don't need. And they're giving you an AI-generated report about your lab, so there's no human interaction. And then you get a phone call from a doctor for about 5 minutes. I just heard this last week. They rush you through the visit. They put you on a hormone that they are making money off of the prescription. Don't you think for a second they're not double dipping. They're making money on the visit. They're making money on the hormone. That's how they make money. But if you get remotely complicated and you ask a question, you're not going to get an answer. What will happen is the doctor, who is a high income earner, who they can't pay, they need to pay him for the prescription though. So these doctors also get paid probably based on the number of prescriptions they write, probably $5 to $10. They turf you off to a coach, and that's no shade on a coach because coaches I think are great. But the problem is the coach isn't a doctor. So they can't answer these questions you have like, oh, I'm bleeding. Oh, I have a headache. Oh, my dose is wrong. I can't, these are questions for a doctor. The lady I talked to last week that was working with Joy Wellness, she spent $350 on labs, which first of all, you can do through your insurance for probably nothing. And if you can't do them through your insurance, if I order them for my patients, it's $180, which means they're doubling the price. So they're making money on the labs. They charge a membership fee, and then they turf you to a coach. It's a horrible system. It's going to give hormone replacement a bad name. I challenge any of these companies. I challenge the head of Winona, who's an OBGYN, to come talk to me on my podcast. And you can send him this podcast. He's not going to do it because I'm going to expose him for what he is. And that's all I'm going to say about that. These are my opinions, obviously. I would also challenge any of these celebrities, Halle Berry, Tamsin Fadal, Drew Barrymore, to look beyond the dollar signs and look beyond their own egos, because they have look at them. Look at the menopause. Look at this group that they have assembled. There isn't one man on there. Does that anger me? That's a totally different topic. Good. It's a business model. I get that. But here's the deal. They had a great opportunity. They had an amazing opportunity to bring awareness. But what did they do? They're promoting their own books. They're promoting Mary Claire Haver now has her own supplement line. It's all about the money, folks. And they're self-referring to each other. Look behind the scenes. Whenever one of them posts, it's Sharon Malone, it's Ellen, what's her name, the dermatologist. They're all self-referring to each other. MyAlloy, everybody's selling MyAlloy's Estradiol cream, which is a complete load of crap. You don't need Estradiol cream. I talked about that in another episode. Look beyond what they're shoving into your face, because it's all ads. It's all self-referrals. They've all working together behind the scenes. Am I jealous? No, I don't think so. I mean, I wish I had that kind of a platform like they have where they've got 1 million followers. I mean, that would be amazing. But I know what I know, and I know my own ethics. And the point is, it's great to have more voices. It's great to have more information. But you also don't need to be sold to every 5 minutes. And I think a lot of it comes down to the mighty dollar. And that's all I'm going to say about that for now. Share the word. Hormones are important. You are important. And hormones are safe and effective, and they help you live the life that you want to live. I'm Dr. Shawn Tassone, America's Holistic Gynecologist. I'll catch you next week, and hopefully I'll be just as animated. You have a great one.